And today we are talking about a subject called premature ovarian insufficiency, or POI, also known as early or premature menopause. So, Rachel, do you want to get us going today? What is POI?
Yeah, thank you. And hi, everybody. Nice to be chatting to you again. So POI is a condition when the ovaries stop working properly at an early age, and the age that's recognised is below the age of 40, and it means that you stop having your periods, and so that has a number of implications on your health. And we'll talk about a bit of detail as to what those effects are. But it occurs when the ovaries just stop functioning
Yeah.
normally, and so it causes. It's different to the menopause in that it occurs with women under the age of 40, and it can be due to a number of conditions, although often there's no actual cause found. It
It can be
affects
quite
probably
easy to
around.
miss, can't it?
Sorry.
Because it can be quite easy to miss, can't it?
Yeah,
Because
yeah, yeah,
sometimes
absolutely.
the changes are quite subtle, or I find that
Mhm.
women just, they're not really aware that they need to be seeking help when their periods become irregular. Um, and I think generally we know that if your periods are becoming very irregular or they stop for about 4 months, that's when we need to be, as GPs, we need to be investigating what we call amenorrhea, oligomenorrhea for 4 months. So
Mm.
for women out there, if I think if your periods are stopping or just not right for 4 months, that's when we need to be thinking about this.
Yeah.
And I don't know about you, but I will see women who have gone a lot longer than 4 months of irregular periods before they've even thought about seeking help. Um,
Yeah, I mean, it does seem that some women just don't really notice, and or might think that it's nothing to worry about and it'll settle itself down. And sometimes it will. Sometimes it can be due to stress or a change in
mhm.
weight or lifestyle. But sometimes there might be other symptoms that might be more suggestive of early
Yeah.
menopause, like the normal symptoms of hot flushes and night
Mhm.
sweats and vaginal dryness and so on. Um, or some women might find that they're getting mood alterations, they're getting quite low, they're getting up and down. Um, and then
Yep.
there's that group of women who are struggling to get pregnant. And at that stage, it would be worth having a think about whether they might have POI.
Yep.
Um,
Yeah. So sometimes quite subtle, sometimes no other symptoms apart from the missed periods. So
mm,
yeah, there's a whole range of presentations that we see, don't we?
yeah,
Um, but it's a really important condition to pick up on, isn't it? Very, very different, I think. I think it's in a class of its own. It's very different to just regular natural menopause. We actually um, class this as a much more high risk condition, don't we, Rachel?
yeah, we do, because we know that because these changes are happening at a much earlier age, there is a significant effect on obviously on your fertility, but also on your bone health and on your cardiovascular health and on your mental health. So that's why it's really important that we pick it up
Yeah.
early and try and make sure that we address those areas. But there are, as we said, there are sometimes there can be no
Mhm.
apparent cause. There are a few causes, aren't there, that we
Yeah.
just need to have a think about.
There are. I mean, I know definitely. So we know there are situations where it's expected. So then we've got the surgical menopause, so women who are going to have surgical removal of their ovaries, oophorectomies. We anticipate an early menopause in these women. But then, and also cancer treatment. So often women who are going for chemo or have radiation, they will quite often go into an early menopause, again, to be expected. But then there are those other conditions that are much more rare, and autoimmune disorders. So we know about autoimmune disorders that affect our thyroid, adrenal glands, and can cause diabetes. So those are things that we often screen for when we see a woman who has a diagnosis of premature ovarian insufficiency. These are things that we will often screen for. But yeah, and genetic conditions as well, like Turner syndrome. Um, about 10% of women with POI, premature ovarian insufficiency, will have a genetic cause. but really often we don't find a cause, do we? I mean, I know when I've done my complex clinics, sometimes we do all these tests and we do all the screening, the genetics, and some women just have an early menopause, and we
Mm.
don't really know why.
Yeah, I think the commonest reason for POI ends up being, unexplained. And there are a few other sort of very rare things like TB or mumps, which might be a cause.
Mm,
And then we also do know that there are environmental factors that will influence POI and make it more likely. So smoking and alcohol and poor nutrition and deprivation will all contribute towards having an early menopause. So it's things that we should be thinking about it a lot more than we do.
yeah.
And it's
And interestingly, I mean, I heard recently that, I think menopause itself, it varies according to your background. So we know that the average age of menopause in our population is about 51, but when we look at other populations, it can be a lot earlier anyway. So the South Asian population actually have the normal age for menopause is 46,
mm,
which is really young. So
yeah,
for them, I think actually thinking about this early is really important,
yeah,
because their signs of early menopause, signs of premature ovarian insufficiency may present even earlier than what we're
mm,
seeing in other populations.
yeah. And we also
Um,
need to bear in mind, we both work in areas of deprivation, so it's quite common for some women, asylum seekers and so on, to not have a correct date of birth. So that can sort of make life even more complicated if they think they're younger or older
mm,
than what's registered on the database. Um,
yeah, I think the bottom line is if you think you might have signs, just to get yourself tested. So if you're
yeah.
worried about it, if your periods are changing with or without these symptoms, it's quite an easy diagnosis, isn't it?
Yes, it's just a simple follicle stimulating hormone, and the level needs to be raised above 29, 25, 30, and it needs to be repeated 4 to 6 weeks
Hmm.
later. Um,
So yes, it's
it's
just a blood
important,
test. Yeah,
yeah,
to check
yeah,
your FSH level.
yeah. It's important that you're not taking the combined pill or HRT at the time because that will
Mhm.
affect the results. But yeah, it's a very easy test to get done free at your GP.
Yeah, your
Um,
GP can do it. It's very widely available, and really, I think that the take home message for today is if your periods are changing over 4 months and you're young, get that test done. Um, but it does. So we talked a little bit about why it's important. How does this impact women? Because it's such an important diagnosis.
Yeah, so as we said, the most important things are the bone health, the heart health, the mental health, and the fertility. So maybe we talk about each of those um, at a time. So in terms of fertility, having POI doesn't mean that you can't get pregnant, and we know that probably around 5% of women will occasionally ovulate once they have a diagnosis of POI. So it's important to have a conversation as to whether they want to still get pregnant or not. If they don't want to get pregnant, then the combined pill is a really good option, and that provides the same hormone replacement as HRT. So that's well worth having a conversation about. But if they do want to um, if they do want to get pregnant, then it might be that they need to consider having IVF or a donor egg. So if women with POI would be eligible to be referred urgently to consider fertility treatment, and I think encouraging women to understand that it's not it doesn't mean that they definitely can't conceive. There are lots and lots of options out
Mhm.
there now, and I've looked after lots of women with a diagnosis of POI who've gone on to get pregnant by a
Yeah.
variety of different means. So all is not lost,
More
I think is
naturally, yeah. Some of them,
yeah.
like you were saying, that spontaneous return of fertility can happen. It's intermittent. I think about a quarter of women with POI will have bouts of intermittent fertility where it comes back. And actually really important. So if you are seeing signs of, you know, your periods coming back more regularly, it's an important window to
Yeah.
try
Yeah.
for a baby, because you know 1 in 4 women have these episodes where their fertility will return, and about 5% can go on and have a
Mm.
baby
Yeah.
naturally. Um, so yeah, and HRT, we do recommend it, don't we?
Mm.
In these women, and we're going to talk a bit about why we recommend it for um, the other health concerns around POI, but actually for fertility as well. We do know that giving cyclical HRT, which is trying to recreate your body's own hormonal cycles with estrogen and progesterone, does provide actually quite a good environment for conception.
Yes, and the guidance is that we should be providing it in high doses for women with POI to ensure that they've got the adequate replacement of those hormones. Yeah, so your chances of getting pregnant are significantly improved if you go onto HRT once
Yeah.
you've got a diagnosis of POI, and whether that's naturally or by IVF.
Mm.
So
Mm.
that's really important, isn't it?
And so for the other benefits of HRT, because I know obviously there's still sometimes a bit of a fear around HRT, and those, we always discuss the risks versus the benefits in any woman that we're starting on HRT, and it's a very individualized choice. But when it comes to POI, I think it's a bit different, isn't it? We more
Yeah,
than just, it's more than just you know, a recommendation. It's actually something we would really highly recommend, because of the fact that without HRT, these women are then going to have much higher risks of osteoporosis, which is bone thinning, much higher risks of heart disease. So that's heart attacks and strokes. And we know that the mental health outcomes for women on POI, you know, the mental health problems, the distress, the anxiety, the depression, these can be worse, a
mm,
lot more harsh in women. One, because of all the hormonal changes, but also the fertility impacts, or the impact it has around how we see ourselves as a woman going through an early menopause. I know I do see a lot more mental health issues in this group of women that we definitely need to address. And HRT can be one tool in our toolbox to help with mental health as well.
yeah, yeah. And just having a think about the evidence. So because you're starting POI at an earlier age, it may be that some women would be worried about the increase in risks of being on it for
Mm.
longer. Actually, the evidence is there's a couple of studies that have been done looking at the breast cancer risk with women who've got POI, and the evidence is that there's no increased risk of breast cancer if HRT is used at the age of 50, and that's because you haven't got your own ovarian reserve there, and so it's just giving you back what you're missing.
Mm.
So it's really important to sort of ensure that women understand that.
Yeah.
Although I don't think there's much evidence about the different progesterones, so
Mm.
that's still an area for research. But the other risks,
I think
the
generally we
from
say the clock starts at 50. The breast cancer
yeah,
risk, we generally say your cumulative risk of breast cancer and HRT in women with POI or early menopause, that clock starts at 50. So
yeah,
it's not something that should be stopping a woman with POI starting HRT. The benefits very much outweigh the risks in these women, don't they?
yeah, yeah. And there's no evidence of an increased risk of clots. And there's I think there's just observational data, so there's no research that's been done, but the observational data suggests that patients with POI um, will have less cardiovascular risk if they're put on HRT. Um, and there's lots of good evidence about HRT reducing the risk of osteoporosis in all women, and so the evidence would be the same for POI.
Yeah.
And they're all really important, but I think the bone health is a particular issue because if you're losing all that estrogen from a very early age, your bones are going to be significantly thinning, and that has such huge impact um, on, on possibly you having a fracture
Yeah.
at an early
And
age.
we do scan, don't we? We would scan a
Yeah,
woman, we do a DEXA scan in someone who was diagnosed with POI. So we get a baseline of where your bone density is. And then we usually scan every 5 years, don't we? To see what's happening with your bones. And we tend to see, so osteopenia is when your bones are thinner than they should be. And then osteoporosis is when you hit that um, you hit the criteria for going on some of the treatments that we provide for osteoporosis, which can be the bisphosphonates, or HRT can be
mm,
sufficient, even in osteoporosis, can't it? So it's really important that we think about the bones, and we manage those risks actively in
yeah.
these women.
And of course, we shouldn't forget all the lifestyle changes that we would be encouraging for all women. So exercise, weight bearing exercise is really important for women with a risk of osteoporosis. So, doing weight bearing exercise 2 or 3 times a week, lots of walking, lots of swimming, weights in the gym if that's what you feel able to do. And then, ensuring that your diet is rich in calcium. And we all should be taking a vitamin D supplement. Um, Obviously, stopping smoking and stopping alcohol are really important as well.
Mm,
And then thinking
yeah.
about your mood and thinking about, Pilates or yoga or CBT, things that can support your mental health and hopefully
Mm.
make you
And
feel,
there are support groups out there, aren't there? The Daisy Network is a brilliant um,
yeah, yeah,
charity that they're actually run by other women who have
yeah,
POI. So you immediately get support from a network of women who understand exactly what you're going through.
mm,
And and I think that can be support for fertility concerns, that can be support for symptoms that you're going through, or just body image. And there's so many different things I feel that women who have POI go through. It's such an emotional roller coaster that I really think every woman who goes through this needs some kind of emotional mental support through it, because it's a very turbulent
yeah,
diagnosis, very
yeah.
turbulent time, and it can be a very impactful diagnosis, can't it?
Mm. Yeah, I think
um
being able to speak to women who are going through the same thing is really helpful, isn't it?
Absolutely, absolutely. Knowing that you're not alone, and that when it comes to things like fertility, for example, we've seen it. We've seen that there are options out there, and we've seen even some of these women go on to adopt, maybe, and that they can fill their complete their family in that sense. And there are different options out there. And again, when it comes to the symptoms that we see, we can very much support these women with HRT,
Mm.
lifestyle options. Oh, you mentioned the combined pill. When would you suggest the combined pill over HRT? What are the pros and cons of? Because often I'll see a woman, say in their 30s, who have a diagnosis of POI, and one of the things they say to me is, well, which one would you recommend? Would you recommend the combined pill? Because we know that the combined pill also has estrogen, so we're protecting your bones, we're protecting your heart. So that is an option. Or HRT has those components, the estrogen,
Yeah.
progesterone, which can help us with our symptoms and our cardiovascular risk. But I mean, yeah, in your opinion, in that scenario, a 30-year-old woman, which one would you go for?
So there's currently a study going on to compare the two. I think it's called Poise. So we'll certainly await the data from that. But I think the most important thing to think about is whether you need contraception or not.
Mm, yeah.
Because if you're taking HRT, adding on contraception can be a bit complicated. So in that scenario, if you don't want to have a child, if you don't want to conceive, then the combined pill is a brilliant option for you. And I think it's also helpful for women because it makes them feel a bit more like everybody else, in that they'll then be
Mm.
having a period and they're
Can be a
taking,
bit more socially acceptable by the
yeah,
younger
yeah,
women.
yeah.
Yeah.
It's also free, and that it can be more flexible. With respect to, you could tricycle it, or you can back to back the pills if you're
Mm.
wanting to go on holiday. But yeah, I think the reducing the stigma is something to bear in mind. HRT is more of a physiological hormone replacement, and it may be that that's better for osteoporosis, and it may be better for blood pressure as well. And there's possibly more flexibility in terms of the different estrogen and progesterone than there is with the combined pill. So that's something to bear in mind as well. But
I think we
obviously,
have quite a few formulations, don't we? Patches, gels, sprays. So sometimes that can be a better option for women who don't want to take the pill. And also risks. So if we've got other risks, so if they've had migraines, with Aura, for example, we wouldn't be able to give them the contraceptive pill, but we would be able to give them transdermal HRT, which is HRT through the skin. And it can be, like you said, better for blood pressure issues, or if they're overweight, it could be a better option, can't it?
Yeah. So there's flexibility, and the combined pill is one option. But if you end up deciding that the HRT is best for you, then we can still obviously consider and add in contraception as part of that. And we all know that Mirena is everybody's best friend, and that's the best form of contraception. But
it's a good one.
But if that doesn't suit, then you can just take HRT and add the mini pill as well, and that's okay. Patients just need to be aware that they're doing different things.
Yeah, absolutely. So there are options, and I think the important messages are that we need to be picking this up. Women need to be aware that if their periods have become very irregular, or they've stopped for 4 months, it is something you need to be seeing your GP about, to get tested for. But that if there is a diagnosis of POI, you can still get pregnant. Like we said, 25% have some intermittent fertility coming back, and 5% go on to get pregnant. And that support, we really need to be supporting these women, but there are support groups out there, and there are women in very similar situations who are very happy to provide support, and there is lots that we can do.
Definitely. And it's important to remember that they need to have at least an annual checkup, just to check their BMI and their blood pressure and their bone health and other risk factors, so that their treatment can be tailored towards their ongoing risks, because things can change from year to year. Generally, I don't know what happens in your region, but we would refer most patients to the complex menopause clinic just to be assessed, unless we feel able to manage them ourselves, and then patients are generally just sent back to the GP for ongoing management. But it's important that we keep in touch with these women, even more so than other HRT patients, just to ensure that they're getting all the benefits that they need.
Yeah, because all the complications, like the increase in cardiovascular disease, the bone problems, the fractures, we know we can prevent that if we get them on the treatment earlier, sooner rather than later.
Yeah, absolutely. Well, that was a good run through of POI, wasn't it? So
that was a whistle-stop tour, but hopefully that's been helpful.
Yeah. Actually, one more thing that I've just noticed I've written down here is that there are some observational studies that might suggest an increased risk of dementia and cognition, but again, HRT is associated with a protective effect, so that's another really important area to just ensure that that's covered off as well.
Yeah, absolutely, and that's a big area, isn't it? It's something. So women are, the two biggest causes of mortality is cardiovascular disease and dementia. So both of those are things that we want to protect our women against.
Yeah, absolutely. So bottom line, make sure that you come and see your GP or consult with us if you think you might have POI, because it's really important that we start treatment as early as possible.
Absolutely.
Brilliant.
Lovely talking to you today. Brilliant. And until our next episode.
Absolutely. Speak to you again soon.
Take care. Thanks, Rachel.
Bye.
Bye.